Now I will be talking to you about diagnostic tests and labs. Because coronary artery disease is caused by various disorders, many tests take place. A complete health history will be needed, so you could figure out what tests and what lab work we should take. First of all, we will have to get measurement of the atherosclerosis of the artery. What's going on. So we would need lipid, blood, glucose, and also a C-reactive protein test, as well as X-ray films, electrocardiography, ultrasonography, will be nuclear scanning, CT, MRI, angiography to detect affected vessels, especially coronary vessels, as well as single photon emission computerized tomography, which is effective at identifying if there's any ischemia or coronary risk, artery risk. If there is any ischemia, we have to figure out, is there pain, is there no pain? With ischemia with pain, we need the ECG must be done during an angina attack. So there are going to be stress tests to detect if there's any ischemia, and if there is, you'll see ST segment depression. You'll see T-wave depression inner, which means the inner wall ischemia of the myocardium is affected. Then when we have ischemia with pain, we're going to see ST elevation, which means a full myocardial ischemia. With myocardial infarction, there needs to be a 12-lead ECG testing detection because we have to figure out where in the heart is the myocardial infarction occurring. So you're going to see ST, T changes, or new left bundle branch block, pathologic Q waves in the ECG, imaging that shows loss of viable myocardium, or new original wall motion abnormality. We also, one of the main biomarkers would be your troponin. You need to figure out, is there really a heart attack? Well, we need to figure out blood levels of the troponin. We need to see the troponin T, troponin 1, and it should be taken as soon as possible. It can take up to 12 to 24 hours to completely figure out if you did have a myocardial infarction. So most likely the patient will be hospitalized for a day or so to figure out, did this patient really have an MI?